All right, guys. So my name's Josh Trulli. I'm a physical therapy student at Regis University, and so this is just going to be a kind of a quick little video on pain, right? Pain, it's something that we've all experienced. It's something that everyone experiences at some point in their life. And so first thing I want to address is kind of pain and the idea that pain, sometimes we think of pain, it's you cut yourself or you slam your finger in a car door, you touch a hot pot. It's just like, ow, that hurt, right? But think about the emotional aspect of pain, right? Think about how you feel when you hurt yourself. Sometimes you get mad, you get frustrated, you get angry. So that's just kind of to enlighten you of the idea that pain is it's due to some sort of physical stimulus, i.e. the hot pan, or you cut yourself or whatever that is, you slam your finger in a car door. But then there's also an emotional aspect of pain, okay? And then we also have this idea of acute pain versus chronic pain. And so acute pain, basically you have some sort of an external stimulus, right? An ouch. Whatever that is, you touch a hot pan, you cut your finger in a car door, and then that signal has to then come up to your brain to make your brain aware of the fact that you just hurt yourself. And so it does that via nerves. And so these nerves, they come in, starts out at your hand, travel up along, it gets to your spinal cord. The spinal cord is kind of like an elevator. It's got to go up and down, ultimately to get to the top floor, your brain, okay? And so it's going to make your brain aware of that stimulus by traveling up to the spinal cord. And very quickly, just kind of highlight the idea that our brain is organized in a way that our different regions of our body take up different amounts of real estate, kind of here centrally located within our brain. And just one of the key points to note is that you think about how much you're able to sense with your hands and your fingers and your face. So it kind of alludes to the idea that your hands, your upper extremities, your face take up a lot of space here within that kind of region of the brain that perceives these different signals, like touch or pain. And so that's kind of the idea of that's acute pain. That's kind of the pathway it takes. And acute pain is what we consider to be a normal response to pain. You hurt yourself, and it's this protective instinct that we have. You immediately withdraw from whatever that stimulus was that caused you pain. And then when you think about kind of the healing process for days to follow, and you avoid certain movements, like if you burn yourself, you have a blister on your finger, and you might not want to touch things, or you just kind of you avoid using that finger. That is a protective instinct to not cause further damage, so the healing process can take place. Now, where we get into some trouble is when we shift from kind of that acute pain to chronic pain. So now, we thought about it, we developed this memory of that pain, and how we experienced that pain, and we're just overly sensitized to the idea that we hurt ourselves, and now you just feel this pain all the time, even after the wound is healed or that tissue is healed. So think about, you cut your finger, avocados. Do it to people every day. You cut an avocado, trying to get that pit out, you slice your hand open, and you're experiencing that pain. It physically hurts, but then you're also developing a memory around it. And now fast forward a couple of weeks, the wound's healed, and you find yourself walking down the produce section in the grocery store, you see an avocado, you start to feel pain. Maybe that pain never actually went away, even after the wound healed. And then you see these avocados again, and all of a sudden you start to experience more pain. And so that's the idea that, you have developed this memory of it and the way that you experience that pain, and it's just persisting. It's become chronic, right? And so what can we do about it? Well, over here it says, what can we do? There's the cognitive behavioral therapy. That's, we're educating about just kind of pain in general, kind of what this is. And then there's this, you can start to use imaging to kind of think about how it felt when you hurt yourself. There are different processes that you can go through. Relaxation components, learning how to calm down your nervous system, bring your heart rate down. When you start to experience that pain, just relax. And then physical self-regulation, just kind of incorporating diet and exercise and physical activity, and again, like that imagery therapy. And it's key to point out that we can't eliminate we might not be able to eliminate the chronic pain, but we can manage it, right? And that's kind of the idea. You're not alone in chronic pain. You're not crazy for experiencing it. So just reach out, ask questions, talk to your physicians, and you can definitely find ways that work for you to help you manage that persistent pain. All right, that's it. Thanks for watching.